Alan Gray here with the Microbiome First Summit, underwritten by the World Asthma Foundation. We're pleased to introduce our next speaker, Dr. Claudia S. Miller, MD, MS. Dr. Miller is Emeritus Professor for Allergy, Immunology, and Environmental Health at the University of Texas in San Antonio. Dr. Miller champions a new theory of disease to join the germ theory and the immune theory. It is called toxicant-induced loss of tolerance. TILT explains the mystifying range of symptoms suffered by people with chemical intolerances. Today, Dr. Miller presents her session, Toxicant-Induced Loss of Tolerance for Chemicals, Foods and Drugs, a Global Phenomenon. Dr. Miller, over to you.
Today I'm going to be talking about toxicant-induced loss of tolerance, abbreviated TILT, which involves loss of tolerance for foods, chemicals, and medications as a result of environmental exposures. This has become a global phenomenon. Before we talk about how TILT relates to the microbiome and to sustainability, let's start with a quick exercises you can all take. It's called the Brief Environmental Exposure and Sensitivity Inventory. It is a 3-question screening tool used internationally, which helps us determine whether you should be screened more thoroughly for chemical intolerance. First question, do you feel sick when you are exposed to tobacco smoke, certain fragrances, nail polish or remover, engine exhaust, gasoline, air fresheners, pesticides, paint or paint thinner, fresh tar or asphalt, cleaning supplies, new carpet or furnishings? By sick, we mean, do you experience headaches, difficulty thinking, difficulty breathing, weakness, dizziness, upset stomach, or something like that? Second question, are you unable to tolerate or do you have adverse reactions to any foods, such as dairy products, wheat, corn, eggs, caffeine, alcoholic beverages, or food additives, such as MSG, food dyes, or something else? Third question, are you unable to tolerate or do you have adverse or allergic reactions to any drugs or medications, such as antibiotics, anesthetics, pain relievers, X-ray contrast dye, vaccines, or birth control pills, or to an implant, prosthesis, contraceptive chemical or device, or other medical, surgical, dental material or procedure? Now tally the number of yeses or nos that you have, and we'll discuss it further in a moment. As depicted in this illustration, TILT is a 2-step process. First, initiation, involving acute or chronic exposure to environmental agents, such as solvents, pesticides, or indoor air contaminants. And number 2, followed by triggering due to previously tolerated chemicals, foods, or drugs. Masking is a waterline, and notice that it hides the relationship between exposures and symptoms. And you see on the left, the physician, MD, in the ship, and seeing the symptoms, making a diagnosis principally based on symptoms and not the underlying 2-step process involved. So how did we start to understand this 2-step process of TILT? The first paper we did had to do with the people exposed to pesticides in their homes or remodeling, very different exposures, remodeling involving mostly volatile organic chemicals. Pesticides were organophosphates. And this was published, you'll notice, back actually in 1995, almost a quarter century ago. It's the first paper on TILT. It led to the Quick Environmental Exposure and Sensitivity Inventory, which you will see next, and it led to our understanding of TILT. This chart summarizes the kinds of exposures that set off symptoms in these patients who became ill in their own homes. Insecticides, very common fragrances, exposures to paint, carpeting, newspaper print, and many other things were reported as problems in terms of triggering symptoms. And you'll notice that both the organophosphate and remodeling groups, those black and white bars, all of them had many, many different exposures, but much the same exposures causing problems. About 75% of them had these, all of these exposures that were triggering symptoms. We also asked about their sensitivities to particular foods, and to our surprise, both the organophosphate and remodeling exposed patients reported the same sorts of foods causing problems, and in nearly the same order. So if you start at the top, you'll see there's chlorinated tap water and MSG, but as you go down the list, you see dairy products, drinks and things that contain caffeine or xanthines, wine, alcoholic beverages, red wine, white wine, beer, and so on. And what's remarkable is the fact that these very different initiate exposures led to much the same kinds of chemical intolerances and food intolerances in both of these exposure groups. The first physician to report these adverse food reactions and chemical intolerances in his patients was a Chicago allergist named Theron Randolph. He wrote 4 books, more than 300 medical articles, and designed the world's first environmentally controlled hospital units. Here up above shows the features of an environmental medical unit. While at home, patients were experiencing symptoms related to everyday exposures, chemicals, foods, and drugs that they were exposed to regularly. In an environmental unit, they breathe clean, filtered air, drink pure spring water, and fast for a period of days, several days. Once at a clean baseline, that is unmasked, patients can then be tested with organic foods, 1 per meal. On a tolerated diet, then, they can be challenged with common, everyday, low-level chemical exposures. Now, recall the 3 questions we asked you at the beginning. We asked the same questions of 10,000 American adults and found that this is a distribution of their intolerances. So among those who actually fit the definition for chemical intolerance, about 20% of them had intolerances for chemicals, foods, and drugs, 11% for foods in the red, 8% for drugs, and 28% for chemicals. But if you look at that green ellipse, you see that foods were prominent in terms of intolerances, literally in over half of the individuals that we surveyed. Besides our studies of people exposed to pesticides and remodeling, we've studied other exposure groups. In this publication, we studied people who became ill following the Gulf War, breast implant patients, and others who said they became ill after specific exposure events. This is a study that confirmed the validity of the QIZI. So what is this QIZI that I'm going to be talking about? It is an internationally validated reference standard for assessing chemical intolerance and TILT. It's used by researchers and clinicians worldwide, and there are studies published in more than 50 peer-reviewed journals which use the QIZI. This is a valuable tool for you as practitioners or researchers. So I would like to review the content and how it relates to food intolerances and the microbiome. Don't worry about reading all the details here. This is information available on our website at tiltresearch.org, but it shows how there are more than 70 publications by researchers in 17 countries which have used the QIZI. Let me go through the QIZI with you. It has 4 scales, and I'll talk about how they're related to the microbiome as we proceed. Each scale has 10 items derived by factor analysis and rated from 0 to 10 in terms of severity. There's also a masking index, which refers again to ongoing exposures that can interfere with people recognizing which things are triggering their symptoms. If you look at the right-hand panel, you'll see the kinds of chemical exposures that are listed on the QIZI, and we have people rate the severity of their symptoms to diesel, engine exhaust, tobacco, smoke, insecticides, gasoline, paint thinner, cleaning products, certain fragrances, fresh tar or asphalt, nail polish remover, new furnishings, and so on, like a new shower curtain. And people score each of those items from 0 to 10 with a total potential score up to 100. Our most sensitive patients have scores that high. Finally, number 7, alcoholic beverages, even in small amounts, such as 1 beer or a glass of wine, would trigger symptoms in individuals. The Gulf War veterans who could consume a number of beers on a weekend found that even 1 beer would make them very ill after they returned home from the Gulf. In women, oftentimes, if they drank wine, red wine was worse than white wine. Red wine has more congeners and appears to trigger symptoms more readily. And then there are other items on the scale. So people may have sensitivities to various things like fabrics, cosmetics. They may have problems tolerating or even having, kinds of allergic reactions to medications. That didn't bother them before. And the final one is problems with any classical allergic reactions, hives, anaphylaxis, and so on, which is different from this kind of reaction we're talking about here with mast cells. But nevertheless, you can have both allergies and intolerances. This is the Queasy Symptom Severity Scale, and it has people rate their symptoms from a 0 to 10. Everyone can do that. For musculoskeletal symptoms, airway, mucous membrane symptoms, heart-related symptoms, GI symptoms, cognitive, airway, neuromuscular, head-related symptoms like headaches, problems with skin such as a rash or hives, and finally problems with their urogenital tract. These symptoms were all derived by factor analysis of large numbers of people who became ill after an identifiable exposure event. At that time, we didn't understand what the mechanism was, so we were just looking at what people reported. Notice that question number 4, very relevant here, asks people to rate the severity of their symptoms associated with their stomach or digestive tract, such as abdominal pain or cramping, abdominal swelling or bloating, nausea, diarrhea, or constipation. Of course, these are common complaints when you're dealing with people who have their microbiome, gut microbiome has been disrupted. And chemical exposures can do that. I think that's an important point that I'm trying to make, is that it doesn't matter if people are exposed to a chemical in the air or to something they eat. They can develop problems related to some impairment of their microbiome. Remember the iceberg drawing and the water line, which masks all of the exposures below the water line so that the patient and their doctors are not aware of what is actually triggering their symptoms. Well, this masking index helps determine those kinds of exposures that may be keeping people from being aware of their intolerances. First, do they smoke or dip tobacco once a week or more often? Use alcoholic beverages, beer or wine once a week or more often, and so on. Caffeinated beverages, using fragrances. This is a very important one, given the ubiquity of fragrances now in scented personal care products, hairsprays, and cleaning products. Is their house or their workplace been sprayed for insecticides or fumigated in the past year? Are they routinely exposed at work to one or more chemical exposures, smoke, or fumes? Other than themselves, does anyone routinely smoke inside their home? Is either a gas or propane stove used for cooking in the home? This is something Randolph noted, that if you got the gas stoves out of people's homes and they were very sensitive, they often would improve. So they would turn off the gas for a while, use electricity, and then turn back on the stove and see what symptoms they developed. Is a scented fabric softener, liquid or dryer sheet, used routinely in laundering your clothes or beddings? Think about that. Your bedding and your clothing are right next to your breathing zone, so whatever fragrances are associated with those are things that you're going to inhale. Do you routinely, once a week or more often, take any of the following? Steroid pills, prednisone, medications for pain, requiring a prescription, and so on. Because those can mask people's recognition of their intolerances. And we have them add up the number of items on their masking index. And if they're more than 2 or 3, they're maybe very masked. And certainly if they smoke, they're very masked. Finally, on the Queasy, we ask about the impact of their sensitivities on their lives, how they've affected their diet, their ability to work or go to school, how they furnish their homes, the clothing they choose to wear, their ability to travel to other cities or drive in traffic, the choice of personal care products such as deodorants or makeup, their ability to be around others and enjoy social activities, for example, going to meetings, church, restaurants, and so on. Their choice of hobbies or recreation. Many have to give up hobbies, such as going to the racetrack, where there's a lot of auto exhaust. Their relationship with their spouse or family. This is often a big item, especially if the family member wears a lot of fragrances or smokes. Their ability to clean their home, iron, mow the lawn, or perform other routine chores. And this can be because of fatigue, but it may be exposures associated with those kinds of chores. So what can you or a doctor or anyone who is working with patients like this do? Well, you can give them the Queasy and then graph out the severity of their symptoms on those 10 scales: head-related, cognitive, mood, neuromuscular, musculoskeletal, skin-related, genitourinary, GI symptoms, heart-related, airway, mucous membrane. Actually plot them on this target diagram, and those little hatch marks, each one of these systems is scored from 0 to 10. And you can see, if you connect the dots on this, how extensive this particular person's symptoms are. And it's a very interesting individual who moved into a home that had a lot of mold. And prior to the mold exposure, he reports the severity of his symptoms in those domains were minimal. The green lines show that, where once the exposure occurred, the red lines show how extensive his symptoms were. Again, the red lines in the next figure on the right, the same as on the left. Those are how that person presents right now. And then with intervention, which could be avoiding the exposure, medications, their symptoms improved substantially. And you can see the blue line represents the new kinds of symptom severity that person experienced. So they improved. So this is very useful. The symptom star and these ratings, and the star help tell you how severe the exposure was in terms of making them ill, and also how effective your interventions are. The last part of the self-assessment we invite people to take regarding tilt is to fill out a brief exposure history, which they can take to their physicians or show their families. Did they become sick after a particular exposure event like pesticides or remodeling or breast implant? What was the exposure? When did it occur? What symptoms did they experience at the time? Next, were any other people or animals exposed? There are individuals whose cats died, and it turns out that cats are especially sensitive to organophosphate pesticides. What symptoms, if any, did they experience when they were exposed? How have their symptoms changed since that original exposure? And are there other details that they want to tell us about? And this concludes the self-assessment for chemical intolerance, which the person can now take to any of their physicians and help get any kind of diagnosis with its chemical intolerance or tilt if there was an exposure event that led to it. You can print out a copy of all of this information from our website, which is mentioned here, tiltresearch.org. We do not charge for any of this. You have to find someone who can help you, whether it's someone helping you fix your house or a provider who can help you understand this. But it provides a very comprehensive exposure history and helps diagnose chemical intolerance and tilt. So you go to the website and you click where it indicates self-assessment, and you can print that out for yourself. So what has happened that we have so many people now, 20% of the population, who have chemical intolerances, many from a specific exposure event? Well, it all started after World War II, and that was when Randolph made his discoveries. Synthetic organic chemical production since the 40s, you see on this graph, have increased dramatically since the 40s and continued to do so. And it's increased, these chemicals increasingly are finding their way into the things that we inhale, things that we eat and drink. So there's no question that these are a concern. And now we're seeing the effects of those exposures. Those exposures are further complicated by the fact we spend 90% of our day indoors, more during the pandemic. And you can see, going back to 1900, it was when people didn't take a lot of baths. The ventilation standards required 30 cubic feet per minute per person of fresh air. Now, those standards, the American Society of Heating, Refrigeration Engineers, air conditioning engineers, have been revised. And around the 1970s, during the oil embargo, some of you aren't old enough to remember that, those were re-evaluated and dropped down to 5, from 30 down to 5 cubic feet per minute per person, and applied to commercial buildings, schools, and places like that, not homes. So homes have no minimum requirements. However, as you know, people have been encouraged to reduce their energy consumption, and often that's by reducing fresh air. And that effect on people and what they breathe has been huge, disastrous. And so this has been increased now in commercial buildings to 15 or 20 cubic feet per minute per person. But still, there is no particular requirement for homes. And many buildings were built during this era when the standard was down around 5 cubic feet per minute per person. So what have our own studies of 10,000 Americans shown? Well, more than 7,000 met the Queasy criteria for chemical intolerance, that is, symptoms and chemical intolerances greater than 40. And nearly half of them reported an initiating event. And you can see that the most common one was mold, 15% of people. 13% reported remodeling or new construction, medical procedure, pesticides, combustion products, implants were others. And even though breast implants were less frequent, the symptom severities on these individuals is very, very high. And many people, about half, did not know a specific initiator. However, remembering that graph of exposures to various synthetic organic chemicals since World War II, many people have had exposure since they were born, or even before they were born, while they were still in utero. And this process, the effects on their mast cells may have been initiated then. And we're going to talk about mast cells in a moment. But just understand, just because people don't recall initiating an event does not mean that sensitization of these important parts of our immune system that are not antigens and antibodies but involve mast cells may have occurred and people don't recall what happened. These are some of the comorbidities or conditions that also appear to have origins in TILT, or at least may, and these include many so-called neuropsychological symptoms that are attributed to psychiatric kinds of problems, when in fact they may be based on exposures that initiate and trigger symptoms. For example, autism spectrum disorders, which we are studying now, attention deficit disorder, depression, migraine, seizures, memory and concentration difficulties, irritability and sudden rage, which the Gulf War veterans would report when they were exposed after they got home. People with the road rage syndrome, or people who are getting rage on airplanes, need to think about these things as being triggered by exposures that people have not had perhaps for a while. Gastrointestinal difficulties, which we've talked about at length, connective tissue kinds of disorders, fibromyalgia, lupus, other autoimmune diseases, cardiovascular problems, certainly arrhythmias and hypertension are common. Respiratory difficulties, asthma has been increasing in prevalence. Reactive airways dysfunction, toluene diisocyanate is one chemical we know can induce this kind of a hypersensitivity. Looking around the perimeter here, ear, nose, and throat conditions, sinusitis very definitely, and you have many. The sinuses are lined with mast cells, which help protect us against any external foreign substance, whether it's a chemical or is an intercellular virus. Polyps, recurrent infections, dizziness, ear, nose, and throat doctors often see that. Miscellaneous syndromes, including things that are now more commonly occurring since World War II, chronic fatigue syndrome, Gulf War illness, we talked about post 9/11, after oil spills, and other similar kinds of exposure events. Breast implant illness, where we have looked at those individuals and they have very high rates of chemical intolerances and food intolerances, and many of them do not improve until they have that breast implant removed. In other words, the initiating vent or initiator is removed. Many kinds of skin reactions and eruptions that may be related. When I say may, these things all need to be studied. They can be studied by good researchers who work in these fields, and they can use the Breezy, the Queasy, and the exposure history with their patients if they want to start to understand organic origins for these conditions. This is not all psychogenic, and especially the psychiatrists and psychologists need to pay heed and ask these kinds of questions when they see a patient. They're often some of the best people in terms of ruling out something like lupus or another problem which has a physical basis. So the psychologists and psychiatrists who have not had this kind of training and don't know about the effects of chemical exposure, so not toxicologists or immunologists, they can still take a history like this, or their patient can gather this information and take it to their psychologist, psychiatrist, ear, nose, and throat doctor, GI specialist, primary care physician, and help establish that this is what has happened to them. Our own study, which looked at the rates of chemical intolerance using the Queasy in mothers of children with autism and ADHD versus mothers who had children that were neurotypical, found that the chemically intolerant mothers, again, gauged using the Queasy, were 3 times as likely as the control mothers to report having a child with autism and 2.3 times more likely to report a child with ADHD. So we feel very strongly that that tilt is an underlying disease process, really a new theory of disease, mechanism for disease, that helps explain a lot of what we have been seeing in our population since World War II. So what is going on that we're now seeing so many conditions, so many of these chronic illnesses that are not infections since World War II? And that's what this conference is all about. And how do we sustain or even hopefully improve the health outcomes that people are having and improve our whole society? About 3 years ago, I ran into a person named Larry Afrin, whose name is listed on this slide, and he's an expert in mast cells. I called him up and I said, Larry, we have these patients who have these symptoms in almost every organ system. They say they're sensitive to chemicals and to various medications and foods. And we've been seeing it for, decades. Now, he was recommended to me by a patient who was a journalist who invited me to call him. And of course, I thought I knew everything there was to know about chemical intolerance, having worked in this field for 40 some years. In fact, when I called him and I told him about my patients, he said, well, my patients are just like that. Well, he hadn't heard about tilt or chemical intolerance, and I had not heard about mast cells. So what we did, we were very excited. We initiated a study of his patients using the Queasy. And when we did that, we found that 61%, almost 2/3 of his patients fit Queasy criteria for chemical intolerance. In other words, initiation by some exposure event and now triggering of symptoms by chemicals, foods, and drugs, and symptoms that affect every organ system, and also that they were not responding well to medications, usual medications. Many were avoiding exposures because they knew those would trigger their symptoms. So we were both surprised to see how many of their diagnosed mast cell activation syndrome patients fit our criteria for chemical, food, and drug intolerances, or TILT. And so this has launched us into a new era of understanding that mechanism, helping people become well, or at least avoid getting sick by noticing which exposures are responsible for their symptoms, avoiding things where they have no choice, minimizing their use of things like fragrances, very important, minimizing any use, avoiding any use of pesticides, using other safer kinds of ways to control insects, which we've advocated for years anyway. So we have a way now to help prevent these conditions and counsel people when they go to see their OB-GYN or their own doctors about how you can avoid these exposures, which may put your children on your offspring at risk. And this is a picture. Here's what we've been talking about, the mast cell. The mast cell is the first responder in all of our tissues to any foreign substances, including simple chemicals, including pesticides, including intracellular viruses like COVID and others. And it responds to anything foreign that comes into our bodies. They are present at the interface in the tissues that are exposed to our external environment, whether it is the GI tract, exposed to foods and other things we ingest, whether it is in our airways, in our lungs. They are the first responders, and they release huge amounts, literally hundreds of different so-called mediators or molecules that help protect us against that exposure. Many of these contain histamine, which help dilute out whatever the foreign substance is. But there are literally dozens and dozens of different mediators that can be released by this cell once it's been sensitized. So like we talked about, TILT is initiation followed by triggering by substances that were never a problem for that individual before. And the mast cell is a perfect representation of how this occurs. On the right is a picture, actually it's a drawing of how they look with releasing these little bits of mediators, molecules. And immediately when they see a foreign substance they've encountered before, within less than a second, they will release their preformed mediators to try to help that protect the person, the host. Those mediators cause inflammation in many cases. And mostly what researchers have been doing is looking at all the gazillion little mediators, which are in tiny quantities in the bloodstream. Unlike antigens and antibodies, who circulate in very tiny amounts, you have to go look at the tissue where these mast cells live in order to see that they're responding to whatever they inhale, whatever you inhale, what goes into your GI tract, what is in any system of the body, the skin. So again, they are in the interface, or at the interface between all of our tissues that are exposed to the external environment, and they are there to protect us. They do it well. Unfortunately, the consequence for us is inflammation in many cases and severe kinds of reactions that people can have involving any organ system. So mast cells are unique in that they, for the first time, help us understand the likely origin of TILT, a phenomenon we've been describing for the last quarter century, and for which there was no biological mechanism. And now this is highly plausible and needs further research and studies but this is certainly something that makes sense and helps explain why people become sensitized to very tiny exposures that don't bother most people until they have a repeated high-level exposure or chronic low-level repeated exposure to VOCs in a sick building. That's what will sensitize the mast cell, and upon re-exposure to that foreign substance, food, whatever it is, can trigger responses. So what can we do with the GI tract? Well, people go through elimination diets like Randolph did, which are very arduous. My hope is that by studying and using more of the pre and probiotics that we're discussing at this conference, we already know that some people respond very well and they decrease their GI problems as a result, and actually their cognitive and mood problems improve too with the use of these kinds of probiotics. So addressing the GI tract is absolutely critical in this, and a wonderful first step, as this conference suggests, in terms of our gaining control over our responses to the external environment. Another big part of it is minimizing exposures to things like pesticides and to chemicals, synthetic organic chemicals that we don't need to have, and avoiding those things, using environmental units. Every hospital should be set up as an environmental medical unit, so we can really look at all of the exposures that are everything that's inhaled, ingested, contact the skin, remove that and see what happens to the person's autoimmune disease, to their cognitive and mood changes. This is what Randolph observed, and which is so impressive, can be done now, but now our exposure environment, because of the introduction and increase in synthetic organic chemicals over the last, since World War II, it has become increasingly difficult. These things are in our water, our food, in the air we breathe. So this is a challenge, and it's a real challenge to not just getting people feeling better who are sick, but protecting others, preventing ADHD, autism, fibromyalgia, chronic fatigue syndrome. A lot of things are comorbid with these chemical intolerance problems. So the Queasy, which I've given you now, it's free to anyone who wishes to use it, is a tool you can use for yourself, for people you know, for practitioners, researchers, so they can start to understand the origins of these complex, non-communicable diseases that now we have a different mechanism. Actually, people feel it's truly a new theory of disease involving our environmental chemical exposures, leading to the host of the myriad illnesses and problems that we see today. So I hope this has been stimulating to you as it has been to me working in this field. I feel very fortunate to have learned the things I've learned. I've had wonderful mentors, and I appreciate the people, Bill Cullifer and the World Asthma Foundation, for having the insight, having the knowledge, how important it is to see the whole, not just what we eat, what we breathe, what we drink. All of these things impinge upon our sustainability for the future. And welcome hearing from anyone who wishes to write to us. Go to our website, again, tiltresearch.org. And our papers that I've presented to you mostly are available free online, can be downloaded. And I thank you for your attention.